Dr. Paul here, August 13th, my second live stream on YouTube. Welcome everybody who's joining in on this. What I wanted to share is that I am so grateful to all the viewers of our YouTube channel. I've got my producer, Noah, Big No-No, is going to help me with this, and he's suggesting that we let you know about Super Chat because he gets like hundreds of scrolling comments and questions, and I guess that moves your question to the top so he can find it easier. So that's a tool that's available to you. A topic for today I thought I would share with you. I just want to start by saying I know a lot of my viewers on YouTube are there for just the entertainment value, sometimes for the information, and I'm grateful to every last one of you. The last live stream we did had a lot of questions about vaccines. That's just the nature of sort of my viewers who want to ask questions, and I don't want the other viewers to feel like, wow, you're drowned out. I am a general pediatrician. I take care of general pediatric things. In the course of that, we sometimes have gross things like earwax and abscesses and warts, and people seem to love those. That's fine. We'll continue to produce videos with interesting and gross content, but if this ends up being a lot about vaccines, that's just the nature of my other viewers. Now, I wanted to just share with you today, before we get rolling, I stumbled on the most recent morbidity and mortality tables from the CDC that tells you the diseases and their prevalence right now. How many cases of hepatitis B do you think there have been this year in 2017 up through July? 9. 9 perinatal cases out of 4 million births. So as you can see, this is not a huge issue. There have been about 100 to 300 per year in previous years perinatally. Not a huge deal. If we've got questions, I'll start taking questions. I'll throw out some other statistics from those tables as we have time.
All right. Princess 44 just wants you to know that you are her favorite YouTuber.
Oh, thank you, Princess 44.
Wonder CX would like to know, what's your bigger goal right now?
My biggest goal right now is to set up a registry where we follow over time kids who are either unvaccinated, partially vaccinated, or fully vaccinated, and collect data over basically decades. This is what's lacking. We don't have that research, and I'm going to work hard to make sure it happens.
Dragonite wants to know why amoxicillin causes rash if a person has mono.
We don't know. At least as far as I know, we don't know why. It's an idiosyncratic reaction. In other words, idiosyncratic, it just happens sometimes and nobody knows. Good question.
Lucky would like to know, Enfamil or breast milk for newborns?
Well, if you're lucky, you'll have breast milk. I've heard that cow's milk is for calves, and of course, regardless of the formula, they're almost all cow milk based. Soy formula is even worse in that it's extremely high in aluminum. Not a good choice unless you're absolutely stuck with that being the only formula that works.
Jamie Jason would like to know, what's the hardest part of your job?
Definitely the charting. Now most doctors are on what's called electronic medical record, and you're having to enter a ton of data into the computer, and you try to do some of it in the office visit. So in my case, I can't type really well without looking at my fingers, so I'm doing this all day long and trying to make eye contact with my patients. It was so much easier when I could just look you in the eye, chat with you, examine your baby. So yeah, definitely navigating the electronic medical records is the hardest part of the job.
Hui Tran would like to know, how are you and how is your wife?
Oh, thank you, Hui. I'm doing great. I'm feeling better than ever. I just started CrossFit, talked into it by my wife, actually, who got ahead of me by 2 months. I said, honey, if you stick with it, I'll do it. I had tried it a couple years ago, hurt myself, and thought, this is for young folks. I'm really excited to be back into it, and for whatever reason, well, a very good reason, I'm feeling great, and so is my wife.
On the contrary side of things, Fowler Fishing would like to know, what is the easiest part of your job?
Oh gosh, I love kids, and the easiest part is just interacting with them. Almost every single time I walk in, I give them a smile, make some eye contact, I get a smile right back. Easy, fun, rewarding. If you like kids and you're good with them, go into pediatrics.
JB Arsick, or J Barsick would like to know, how do you feel about intermittent fasting for weight loss? I've lost 40 pounds.
Well, it sounds like you've used it and it's worked, and actually I've read a little bit on it, and it is a technique that works real well. You're still getting your nutrients, you're still getting, especially if you're eating good food, real food, it puts your body into a fat utilizing period of time, and it works.
Candy Hines would like to know, Dr. Paul, what happens if you drink liquor every day?
Well, there are people, I think, who can do that in moderation and not have a problem. So there are the studies, right, that show a little bit of red wine, especially red wine, but a little bit of alcohol is actually beneficial to your health. And this is well established, well known, indisputable. The problem for some of us is we drink too much. And if you drink too much and you're drinking daily, you're going to for sure get into trouble with that.
Armin Gamer HD would like to know, what is better for cleaning wounds, soap or alcohol?
You know, I like soap and water. I really do. I think the alcohol would sting. You probably could do either, though.
Girl Talk 101 asks, is coffee bad?
Coffee, there's a recent study that came out showing health benefits. I'm a coffee drinker, so it's like, yes, I knew there was a value to this. You know, it has health benefits. If you drink too much, and this is caffeinated coffee, you're definitely at risk when those caffeine levels get really high.
Extra P would like to know, what should you do for swimmer's ear?
So swimmer's ear is when the canal itself has gotten inflamed and infected. If you pull your ear, it hurts like heck. That's how you tell swimmer's ear. So, I mean, you can just see the facial expression. There are steroid drops that include an antibiotic. Those work real well. Generally, that's what's going to be required if it gets severe.
Kate Hansen would like to know what your opinion is on Gardasil for boys.
I don't like Gardasil for anybody, folks. This vaccine was rolled out with studies that did not use a true placebo. So what they did in almost all the studies, all but 2 of about 17 studies that were conducted to show that this vaccine was okay and safe, used aluminum-containing vaccines or the previous HPV-4 vaccine when testing the recent one. So you have all these horrible side effects in the studies, and they're saying, well, there's no difference, so it's safe. It's a very dangerous vaccine, period. I wouldn't recommend it for anybody.
Lily Blogs asks, how long have you been a doctor?
I graduated from medical school in 1985, so that's when I was certified MD.
About a Mother wants to know, would you ever see a family from Canada if they came to you?
You know, I'm getting requests all the time for new patients trying to come in and see me, and I'm unable right now. In fact, we're closed to new patients unless you're local and have a newborn. Just the sheer volume of requests. I hope in the future to have some mechanism where I can do consults for people who are not in Oregon, but in Oregon you have to establish patient care with a face-to-face visit, and that's made it very difficult.
Wenji Fan asks, does stitches hurt?
So stitches themselves should not hurt if the wound has been properly numbed up with lidocaine. You'll just feel a little pull or a little tug, but you shouldn't be feeling the needle going through if the wound has been numbed up. If you're feeling sharp pain, you need more anesthesia, the local lidocaine.
It's Gigsy asks, hey Dr. Paul, I have an ingrown toenail that comes and goes through time. Do you know if it will ever go away? And if it will, when?
So ingrown toenails, I'm going to show you my ugly thumbnails here. If you cut your nails and you leave a sharp edge right here, that sharp edge can grow into the tissue. What you want to do is get a file, like I'm using my nails if it was a file, and file down those sharp edges after cutting your nails, and hopefully that will prevent it from digging into the tissue. So yes, you can conquer ingrown toenails most of the time without needing to have major surgery, or minor surgery, I guess it would be.
Hunter Etheridge asks, Dr. Paul, I have flat feet. What should I do?
The flat feet dilemma. Most people with flat feet have no issues with it. Podiatrists would disagree with me, and so to get that other opinion, you would see a podiatrist. I know in the United States anyway, they do have these stations in certain stores where you can stand on them. I think it might be called Dr. Scholl's or something like that. And they make a custom orthotic for your foot. And that's certainly another option. I do know people, I've come across people who have severe pain because of flat feet. So definitely, if you're having trouble, get it looked at.
Let's remind people about Super Chat and let them know that tons of questions are going by. We can't get to
So Big No-No tells me there's just tons of questions flowing through. We do have Super Chat. Feel free to give it a try, and that'll bring your question to the top.
And we will answer it.
And we will answer those questions that are rising to the top because of Super Chat. This helps support the channel, and we definitely appreciate that.
Iron Sword asks, I have a mole. What do I do?
So not knowing your age, what the mole looks like, where it's at, etc., I can't really advise you. Moles should generally be looked at by someone who understands what they're looking for, because some are precancerous.
Jay Barsig asks, well, now I have to say it. Does your son have any advice for depression and anxiety?
Oh, Big No-No has definite advice for anxiety and depression. That was his journey. His channel is Big No-No, BIGNOKNOW on YouTube. Lots and lots of great material there. Check it out.
Auburn Medical Group says, I'm so glad I caught you live.
Hey, shout out to Auburn Medical Group. That's one of my pals here on YouTube. We just did joint venture together this past week. He came all the way up from California to visit me, and you definitely need to check that out. Thanks a lot.
Coco McFluky asks, how do you treat dandruff?
Dandruff is dry skin of the scalp. It's all flaky. I would say there are different approaches: changing your diet to whole, real food, avoiding anything that causes inflammation, and check out some of the natural ways of moisturizing your scalp. That might help. It could be also your soap that you're using that's causing trouble. There are, of course, over-the-counter anti-dandruff shampoos that you could try.
T. Long says, hi, Dr. Paul. Love ya.
Thanks, Tilone.
Alfie C. asks, how long does it take for a big toenail to grow back after it's fallen off?
I would say, based on the experience we had, you should check out the video where I actually removed a nail from my wife's. She had jammed her thumbnail, I think it was, on a really sharp knife. And that took 2-3 months, I think, basically to grow back. Pardon me, I got an itch.
Amy Mary asks, what do you think about essential oils?
So I'm not an expert on essential oils. I do believe they're safe, although I would not mist them into an infant's breathing space, because there are studies showing that oils breathed into immature lungs can cause problems. A lot of information that's come out with benefits from using essential oils, so I actually, I'm fine with them.
Greg Gonzalez asks, how do you think modern medicine will change in the future?
Oh my goodness, Greg. I don't know how it's going to change. I see things happening where in this country, in the United States, pharma is taking a tighter and tighter grip on medicine, and it's not always taking us in the right direction. We really need to get back to realizing that we are incredibly made to handle the assault that our bodies face, right? So if there's an infection, it's going to come in through your nose to your lungs, or through your mouth to your GI system, or through your skin. And we have systems in place in our immune system to deal with that. And we're not doing what we need to do to support those systems, which is healthy nutrition and avoiding toxins. So we've got to get back to having an approach that builds our own natural immunity, rather than always trusting a pharmaceutical product, be it a vaccine or a pill or whatever, to treat a symptom. So I'm a little nervous about the direction we're going, but there are more and more of us waking up to the fact that there is a better way.
Anthony Garza asks, how did you become a doctor?
Well, I grew up in Africa. My parents were missionaries, thought I was going to be a preacher, realized that wasn't the route for me for various reasons, so decided I want to be a doctor. Well, then you got to go pre-med in college, get into medical school, go 4 years of medical school, 3+ years of residency, and that's it. Bingo, you're a doctor.
Johannes Holland asks, what should I do when my jaw starts making noise?
If it's clicking right here, you can put your finger, one finger in an ear, one finger right by this jaw. And if it's clicking or clunking, that's TMJ, joint dysfunction. You need to get that addressed.
Mr. Celery asks, do you have any hobbies, Dr. Paul?
I do. I like to ride motorcycles if it's safe riding, clear weather. I like to travel. I love my family, so a lot of my spare time, if what little I do have, I like to do those things, and exercise. So right now I'm getting back into CrossFit. I'd say those would be my main hobbies at this point.
Ahmed Shihada asks, hi, what's the cause of sudden infant death syndrome?
Aha. Well, by very nature of its description, syndrome, meaning we don't know. I do know that occasionally, very rarely, an infant can be suffocated by something, right? Sometimes it's a cat, sometimes it's just a nursing mom, they fall asleep in bed. But most of the time, we don't know. There are a couple studies showing there may be a link with vaccines, and you got another one.
Tracy Anderson just did our first super chat for $5.
Thank you, Tracy.
And she just said something you have to tell parents. What's something you have to tell parents over and over again?
I go over the vaccine discussion every day, almost every patient who's coming in with a well child visit, because what we're told to do by the CDC and the Academy of Pediatrics is completely different than what I think we need to do when you take each person as an individual and you look at their individual risk factors. So that and eating real food, their diet, breastfeeding a baby, these are just a few.
Evan Parsons just donated $2.
Thank you, Evan.
And he asked if you can explain DO versus MD, also show your office. I also think you should highlight and let people know why it's blue and that this is super chat.
I'm told that blue is super chat.
Or any color.
Any color?
Based on how much they donate.
Okay, well, if you have color, that's super chat. Thanks. Big No-No, you can hear him, so he can chime in with that kind of stuff.
I will.
And the question was?
Can you explain DO versus MD? Also, show
gotcha.
your office.
DOs take the same training that MDs take, but they also learn manipulation. So that's along the lines of chiropractic manipulation body work. And they also take all the same basic science. They take the same residencies. They take the same certification exams. So we're very similar. They just have a little added skill as well. My office, we've got a couple videos in our video library. I think that my oldest one was a prenatal visit. So you can go back and take a look at my office with that one.
Jamie Salvucci asks, if a mom can't breastfeed, what should they do to best boost the health of their babies and their children?
So if you can't breastfeed, and this happens, you know, it's generally when you've done everything you can and it's just not happening, you have no choice. You have to use some other alternative. So try to pick an organic formula if you're going to go with a commercial formula, and watch how well they tolerate it. The Weston Price Foundation has advice on this if you're wanting to make your own, and I think their system is tried and true, so that's another option.
Armin Gamer HD says, is the an apple a day keeps the doctor away true? P.S. Love the palm tree on you.
So if your apple is organic, you're on the right track. I think it's true to the extent that if you're eating real food, you've got a much better chance than if your food's coming from the middle of the store where it's in bags, boxes, and cans. So shop the outer perimeter, eat real food.
Lucky asks, can cancer be cured without chemotherapy?
So I can't comment to one's specific cancer, but I can definitely tell you this. I was driving to work the other day thinking, what would I do if I had cancer? Because I'm well aware that chemotherapy, radiation therapy, some of these approaches that we use in mainstream medicine are actually hammering your immune system, and what you need to cure cancer is a healthy immune system. I would go all out with phytonutrients, organic food only, and just powering the nutrients that we know boost the immune system. Vitamin C, glutathione, maybe getting IV high-dose vitamin C. There are a lot of alternative things that can be done and have shown to cure cancer. But it's an individual decision, and it's a tough one sometimes with certain cancers where our medical treatments outcomes are pretty good.
Marcus Hughes asks, was there anything you were going to do before you decided to become a doctor?
So I thought I was going to be a minister until I found girls. I thought, no, that wouldn't work. Pretty much I was going to be a doctor since then.
Awkward Turtle 1 just gave us a $20 super chat.
Awkward Turtle 1, you get the prize today.
And
Thank you.
And the question is, tips for staying out of the hospital when having an asthma attack if inhaler isn't helping.
Whoa, so if you're having an asthma attack and your inhaler isn't working, it depends how severe your attack is. I think you have to get help because asthma can be fatal. What you want to do is avoid the attack to begin with, and that I can help you with, which is find out exactly what you're allergic to. I would do a blood test called Immunocap where you identify IgE response to all the major allergens and remove as many as you can. Because with asthma attacks and allergies, you've got to realize that it's almost like threshold. If you're allergic to dust and then you're allergic to cats and then you eat something you're allergic to or you're exposed, you reach that threshold where boom, you're into an asthma attack. So minimizing your exposures hopefully will prevent it from happening to begin with. Secondly, don't get behind the 8 ball, so to speak. When you're having an attack, you've got your albuterol, which is your rescue medicine, and you need to use it quickly before you're so tight in your lungs that that albuterol isn't even getting there. If you come into the ER, the emergency room, with, you almost can't move air at all, you're going to get a continuous albuterol treatment until those lungs open up, along with a high-dose steroid shot. So, obviously you want to prevent getting to that point. If you've got a steroid inhaler, use that as well. But let's prevent you getting in that position to begin with.
Brittany Taylor just donated $5.
Thank you, Brittany.
For Super Chat. Thank you, Brittany. What are your thoughts on circumcision?
So I'm not a fan. I think circumcision is an unnecessary procedure that's just left over from cultural approaches. The problem with doing circumcisions is it's a permanent change to that little boy's body that they didn't have any input on. So think about that. You're taking away a part of their body without getting their permission. That just doesn't feel right. On top of that, we know that they're uncomfortable for that first week, and you're causing stress at a time we know that stress is bad for brain development. So I just sort of feel like we're headed down the wrong path. I'll tell you this, I was circumcised. None of my 5 boys are. It didn't matter that we were different, and they are all quite adamant that they're glad they weren't circumcised.
Henry Pham asks, are Q-tips good for your ears?
So you're not supposed to put anything, smaller than your elbow in your ear. Wait, huh? No, that doesn't work. Q-tips, the problem with Q-tips, if you're just cleaning the outside part here, no problem. If you're sticking it into that ear canal, like where I'm sticking my finger here, what you're actually doing probably is jamming wax in further and packing it down, making it very difficult to get the earwax out. So I'm not a fan of them if you're putting them deep into the ear. For the outside, it's fine.
R3ZO asks, I have a pinched nerve and it's killing my arm. What can I do to treat it, or at least ease some of the pain?
Pinched nerves, so I've had that in my back. I have an old bulging disc injury from when I was in college, and for me, chiropractic visits do the trick. So somebody who's going to do body work or chiropractic, hopefully that will work because you're unpinching that anatomical pinch. Doctors, MDs, that is, basically what we have to offer you is pain pills and muscle relaxants. It's not addressing the root cause unless you're going in for surgery or something. So get it evaluated, but if it's safe to do so, a chiropractor or body work would probably be your best bet.
Kevin Watts asks, how do I stop nosebleeds?
Nosebleeds, as long as there's not an underlying bad reason for the nosebleed, right? Like if you happen to have leukemia or something horrible and you have lost your ability to clot. If it's just your run-of-the-mill nosebleed, you just hold pressure, just like that. Now, if you're a little bit prone to them, you've been worked up and you know there's nothing wrong with you, maybe it's because your blood pressure is a little high, but other than that, it's just your run-of-the-mill nosebleed. You can take some neosynephrine or Afrin, one spray on the side that's bleeding, hold pressure, because that will shrink the blood vessels, and then that stops it a lot quicker.
Nur Sakina asks, is spotting something concerning?
Spotting, I'm guessing we're pregnant and spotting maybe. I would check with your OB on that one because occasionally it's something you need to pay attention to.
Matthew Jordan asks, what's the best way to heal a sunburn?
Ah, those darn sunburns. Well, I think you can use aloe, you can get hydrocortisone cream. If it's really severe and the inflammation is just horrendous, I've seen a few cases like this where you actually have to take an oral steroid like prednisone.
Sonia Valeria asks, hey Dr. Paul, my question is, can I give my 8-month-old cow's milk?
No. Having said that, if you're using traditional formulas, they are cow's milk based. We've found that if you give whole cow milk, they're older studies, but it can cause problems with intestinal bleeding and chronic anemia. So generally we say wait till a year.
Jeanette Ingram asks, how would you know if a cyst on ovaries are growing? Sorry.
Well, the only way would be repeat ultrasound, right? So if you've had cystic ovaries and you're wondering where they're at, 6 months to a year or whatever time frame your OBGYN wants to, or family practice doctor wants. This isn't my area of expertise, but you're gonna have to get another ultrasound.
Wenji Fan says, I have a spider bite, what do I do?
Spider bites, as long as it's not killing the tissue, you can probably just leave it alone and watch for infection.
Jessica Martin would like to know how not to get sick.
This is the right question to ask because we want to prevent illness rather than reacting to being sick. So it's all about boosting your immune system. Avoid toxins, eat real food. I cannot stress enough the importance of phytonutrients. This is plant, fruits, vegetables in large quantities and preferably organic, because if you're eating non-organic, you're also ingesting a lot of pesticides, which only gets you sick anyway. So a lot of fruits and vegetables, omega-3 fatty acids, which is your fatty fish. But if you're trying to avoid, like if you're pregnant, you shouldn't eat a lot of large fish because of the mercury and pesticides in their flesh. So you would do purified omega-3 fatty acid fish oil. Fermented foods are great too, sorry.
Armin Gamer HD continues to ask, can you die when drinking cold water after exercising?
No, look, if you drank a gallon suddenly, very quickly, you could probably have a seizure. And of course there's those very rare reports of deaths from water intoxication, but bottom line is no, especially if you're exercising, you want to hydrate. So I would not worry about that.
Datham asks, what are your thoughts on GMO?
GMO, genetically modified organisms. It's food that's been altered in the lab, or the seeds have been altered to be able to withstand, for example, Roundup, and then you can just spray the crops with Roundup. I couldn't be more against modified foods. It's just because we don't have long-term safety studies, and a lot of scientists all across Europe have looked at this data and agreed it's a problem. So it's banned in many countries. The rest of us, if you're eating these foods, we're being experimented on.
Extra Pete asks, how do you do a super chat? I'm flipping the camera on myself. Hey guys, it's Noah the producer. I believe on your phones or on your computer you will see a money icon, and what that does is you can put it in a monetary value. The more you donate to the channel, which helps support us, the higher your comment goes, the longer it stays there. We will always answer the super chats because it's so incredible, and we'll try to answer every other question we possibly can, but it's just a way to get yourself siphoned to the top because there's so many coming through. Every question matters, everyone matters, but that is what super chat is, and we sure appreciate it. It does support me, basically. We're back to you.
All right, yeah, we're trying to support this guy. He puts in hours and hours and hours on this channel, and he did for years without compensation. So it's just supporting Big No-No, who's actually trying to support his family this way.
Girl Talk 101 is a tough question.
All right, bring it on.
What's your honest opinion on antidepressants and such medications?
Gotcha. So antidepressants have, some of them, a black box warning that it can actually make your risk of suicide go up, especially in adolescents. Studies since that came out have shown that actually it may actually be the opposite way around. So here's my take on it. If you can treat your depression naturally, do so. But if you're desperate and suicidal and this saves your life, it's worth it.
And consult your physician.
Obviously, consult your physician.
Lizette Villa just donated $5 to the
Thank you,
super
Lizette.
chat. Thank you, Lizette. Doctor, why does my hair keep falling? I also smoke marijuana and I drink. Help me.
Okay. Hair falling out is often a thyroid issue, so I would definitely see a doctor and get your labs drawn, because that's treatable if it's a thyroid problem. Sometimes it's just an autoimmune issue in general, so you want to deal with the major causes of autoimmune conditions and inflammatory conditions. Avoid aluminum in vaccines, eat organic. We were talking about the GMO just a moment ago, and there are certain foods that are highly inflammatory. High sugar foods, gluten in general, and sometimes dairy would be the top of my list for foods to avoid, and see if that makes a difference.
Also brings up she smokes and drinks, which says help.
Well, big no-nos right on there. I once smoked and drank too. So those are not healthy habits, and if you're willing to look at that, you will definitely improve your health overall. And so seriously look at cutting out the smoking. There's nothing more dangerous as far as long-term health. It's on average, you lose 10 years of your life with smoking. And if it's marijuana, there's pros and cons. Depends how old you are. And in general, you know, I would look at what happens when you cut back on some of those activities.
Cosmic 313 Fant has made this comment multiple times, so I finally caught it. Hey, I love your channel. Just please respond.
All right. Thanks for the support.
Nikki Wacker asks, do you prescribe antidepressants yourself?
I do, but let me tell you what I also do. When I have a very depressed patient, I look at their neurotransmitters and see if there's something natural we can do, and we talk about all the other things, getting enough sleep, etc.
Insun Choi just did a super chat for $10.
Wow, thank you very much.
And she says, thank you. In the future, can you make perhaps a mini lecture about insulin therapy of pediatric diabetes treatments?
Wow, okay. I'll put that on my to-do list. Insulin therapy for pediatric diabetes. When you have insulin-dependent diabetes, your pancreas has burnt out. The islet cells of the pancreas are no longer making enough insulin to keep your blood sugar in a safe range. And so, frankly, at that stage, it may be too late. Although I'm very suspicious about this one thing. If we could catch insulin-dependent diabetes quick, might we be able to turn around that autoimmune condition? I have some thoughts about that for a future episode.
Awkward Turtle just donated $20
wow.
for a super chat.
US dollars.
US
Last time
dollars.
you had somebody overseas. Thank you so much. Much appreciated.
Asks, tips for dealing with chronic migraines. I get them every day and working with them stinks.
Great. So chronic migraines, if you have anything in your diet that has neurotoxins, glutamate, what we used to say for Chinese food, right? You've got to get that out of your diet. And it's hidden in most products as natural flavors. So watch out for MSG, because often just getting that out of your diet, go to real food, only food, organic food, and it might go away. But the other big thing you can try if you haven't done it is magnesium. I've found a lot of my patients with migraines, if they'll just take magnesium, the migraines either go away completely or are much less frequent. I like people to take magnesium in combination with calcium, so a CalMag supplement, and take vitamin D so you're absorbing calcium properly, or even take a CalMag zinc supplement and see if that doesn't help. But definitely change the diet up and see what happens.
Mark DeCosa just did a $1 super chat just to do it. No
thanks, Mark. Every little bit helps. Big no-no. We appreciate it. Whoa, sorry.
JD Gaming TV just donated $10 for super chat.
Wow, thanks, JD.
Thank you, JD Gaming TV, very much. 22 male had a bout of constipation after passing hard stool a week ago with some bright red blood. Since then, bowels move every other day and cramping. Concerned about colon cancer. Getting better now, though.
So deal with the constipation first, because common things are common and colon cancer is rare, especially at your age. Let's see if you can get your bowel movements normalized by just doing some normal measures that help with constipation. 1, avoid dairy, especially cheese, very constipating. 2, drink a lot more water, a lot more fruit. In general, fruit is good for you. Occasionally bananas and pears can be constipating, occasionally apples, but for the most part, the more fruit the better, the more water the better, and less dairy. If you're still having trouble, for a short period of time, you can add, like when you're constipated and it's so large and hard that it hurts, take a little mineral oil, just a tablespoon or 2, mix it into some pudding or applesauce or something you're going to eat, because straight mineral oil sucks, tastes horrible, blah. Drink that once a day. It lubricates your harder stool out, and sometimes it takes many days to kind of get all the hard stuff out. If you're really, really in trouble with constipation and you need to just soften things up for a short period of time, you can also use Miralax. It's not my favorite, it's not natural, but it draws water into the gut and it does work. They use that in people who are preparing to have a bowel endoscopy being scoped, and they'll tell you to put a whole bottle of Miralax with Gatorade. Don't try that at home. You'll spend the entire night on the toilet. I did it when I turned 50 and went for my endoscope, my GI thing.
Colonoscopy.
Colonoscopy is what it's called. Yeah.
Laura,
Big No-No schools his dad.
one little bit of medical vernacular. Laura Hamby donated $2 via Super Chat. And she
Thank you,
has
Laura.
a question. What if you already have given Gardasil? What now? Can I do anything to help my children at this point? Just started reading your vaccine-friendly plan. I'm quite worried.
So, Laura, good question. I gave all my kids the vaccines back in the day, and I later realized, I wished I hadn't done that. So, first of all, we can't beat ourselves up. Secondly, you're asking the right question. Is there anything we can do now to sort of help with possible troubles from what we've already done, say a vaccine like Gardasil? I would take some silica because it binds aluminum, and I would do everything in my power to boost their immune system and avoid further aluminum-containing vaccines. So how do we boost the immune system? Again, phytonutrients, real food, fruits, vegetables, omega-3s. Make sure you're on a vitamin D supplement, extra vitamin C every day. There are a couple products on the market which boost glutathione. N-acetylcysteine is the precursor of glutathione, and you can take a couple products that actually give you glutathione, and watch very closely for anything happening to the immune system. If the immune system's fallen apart, probiotics, anything you can do to heal the gut will probably save the day. So that's where you go. Fermented foods, and I'll be doing a video in the future about some other creative ways of healing the gut.
We're at 37 minutes. Can you just let everyone know that where we're at and how long about we're going to be here?
Big No-No says we're at 37 minutes. We're going to go for an hour. So we've got, do the math, a little over 20 minutes. 23 minutes. Ah, all right.
So get those questions in, use that Super Chat, get to the top.
Big No-No says go to the top with the largest Super Chat.
Oh, man. Microspec says, what are the types of dizziness? I get confused with vertigo symptoms. What are the types of dizziness?
Gotcha. So the main two types is vertigo, where you feel like the world is spinning, and syncope, where you feel like you're going to faint. Vertigo is thought to be an inner ear issue, and it's rather complicated. Syncope is you're dehydrated and you just faint when you stand up too fast.
Steve donated $10 via Super Chat, and I think he just did it to be a nice guy.
Steve, thank you. And if you think of a question, go for it.
I'll find him in the comments if he does. Thank you, Steve. Did I already ask you this? Jamie Salvici asked, can you talk about the likely causes of elevated IgE levels?
No, you didn't ask that. So IgE is the allergic arm of our immune system. And so the biggest triggers are those things that commonly produce allergies. If you have a family history of asthma, eczema, allergies, it's often in Oregon, it's Timothy grass. For a lot of people, it's dust. Many people have cats and dog allergies, and so forth. So trees, grasses, these are the common things that cause IgE to be elevated, especially if you have asthma. If it's eczema, there's a slightly higher chance it's a food, and in that case with eczema, it might actually be IgG.
Evan Parsons asks, ever deal with transgender patients in your clinic?
I have had one that I was aware of. I wonder if in the past I wasn't as open as I needed to be for people to feel safe. I have totally no problem helping folks navigate that journey. It's so complex, and it's so important that we help people who are not feeling gender identity congruence, so they're not feeling right about that, because there's such a higher risk of, you know, depression and mood disorders, etc., even suicide. So I have had one, and thankfully, though perplexed, this young man who identifies as a woman, his mother was supportive, and she was perplexed but supportive, and that was so huge.
Tanessa Ianelli asks, what can help break down kidney stones?
Ooh, I have to say I'm not an expert on this one. I know it depends on the type of stone, and if you know what type it is, you can have certain diets that will be helpful. But once you've had that stone form, you probably need to go to a specialist and see if they can do that lithotripsy. They have a way of breaking them down that I have no experience with.
Matthew Brooks asks or says, I have a dent in my head. What do I do?
Well, Matthew, how did you get this dent? You know, sometimes you have scar tissue that forms in the superficial part of your skull, and that can feel like a dent. Sometimes maybe the bone just formed in that way. I really can't comment without knowing exactly.
So I found Steve's question, which didn't come up in the super chat. Steve, that's why we missed it, but I see it now, and we appreciate the donation. He asks, she has a question regarding family history of autism. Can you see it? I think he's asking, can you see a history of autism in your family?
So if you have a family history of autism, your risk of subsequent kids having autism goes way up, something like 1 in 5 to 1 in 20 if you have one sibling, for example. If it's once or twice removed, it may not be quite that strong of an association, but it's definitely a huge risk factor. In my family personally, we don't have autism, but we have things that I actually consider ADD and ADHD on the spectrum. And the reason I say that is I was at a conference where several experts have said right across the board they saw kids go from severely autistic through ADD, ADHD. Some of them got stuck there, some of them got all the way better. So we have that family history. And actually, if you do genetic testing, single nucleotide polymorphism testing, that will sometimes identify certain risk factors that I believe are putting us at risk for metabolically not being able to handle toxins, for example.
Dat Ham asks, what's the difference between the common cold and the flu?
Well, the flu is influenza A or B, at least in the severe cases that we identify. The common cold are rhinoviruses and sometimes adenoviruses. Enteroviruses can give you congestion, and so there's a whole long list of things that we call the common cold, and then there's just specifically influenza A and B that we tend to think of as the flu.
Tracy Anderson just donated $8 via Super Chat.
Thank you, Tracy.
Thank you, Tracy, very much. What is the oddest thing that has happened to you as a pediatrician?
Oh, these oddest thing questions.
You better think of something.
I better think of something for what's odd. Oh, I find it pretty odd when a parent comes in and asks for a certain thing and then does something completely opposite. But I don't know. I don't know.
Come on, doctor.
Come on, doctor. I just take everything and just roll with it. So it doesn't feel odd to me. I mean, I'll have kids who are so sick. All right. I had a child once who was in my waiting room for about 20 minutes, near death. And the parents didn't say anything. And by the time they got in, I mean, it was 911, call the ambulance and try to support that kid. I found that odd. But you know, sometimes parents are on the opposite extremes of being overreactive or underreactive to different things.
All right, we've got a serious question now, folks. The Cheshire Cat asks, Cheshire, how do you deal with children who have crippling anxiety?
So I have a lot of these kids in my practice because I have a large following of families who have autistic kids, and many of them have crippling anxiety. What you have to do is be at ease with that child and not be too quick to get in their space, and show that ease and that comfort with them. And maybe, you know, you attempt eye contact, but if that eye contact is threatening, you avoid it and you sort of back away and you just sort of, you know, and sometimes just a little touch, if they'll allow it, just a little touch without the eye contact, for example. You test eye contact, oh, that didn't work. And just being calm and happy with somebody. And the other thing is, I illustrate and demonstrate with the parent who's there. So parent and I start having a really good interaction. and the child who's anxious is watching this, and they're realizing, oh, mom or dad is accepting of this doctor, for example, and maybe they're okay. So I use those couple techniques, and most of the time it works.
Max Seeley just asks, what's the best way to take out a splinter?
So most splinters are sort of superficial, and if you can get to the edge of it and just sort of with your nail, just sort of move it along through the opening, you can sometimes just get it out that way. Otherwise, you need a special little tweezer and try to pull it out, or I'll sometimes tease it out with a sterile needle. And in a worst case scenario, you just have to open the skin up a little bit so you can get at it and pull it out. You want to try to avoid breaking it off, so pulling the splinter with your tweezers in the direction that it went in, you want it to go out the exact same direction.
Luana Cochran asks, what are AIDS?
What is AIDS? HIV? Human Immune Deficiency Disorder? Well, it's an immune deficiency disorder, and this is something that is thought to be caught sexually, and it's now quite treatable. One of the reasons we actually advise, precautions with sexual activity so that you're not in danger of that.
Chelsea Castillo just donated $5 via Super Chat.
Thank you, Chelsea.
Thank you, Chelsea. What can I give my 15-month-old to get him to gain some weight? He has low iron, but nothing else showed up on blood work.
So 15-month-olds are in that process of slimming down. So it would depend. You should look at your growth chart and see if they're slimming towards where they're supposed to be, or are they like having a rough time at the bottom of the chart. But kids need calories, and they need healthy fats and healthy proteins to gain weight, as well as total calories. If you're breastfeeding, make sure you still have adequate volume. A lot of moms who are breastfeeding at 15 months, their volume has gone way down, and they're thinking it's there, but it isn't. So you've got to perhaps supplement at that point with whole milk if they can tolerate dairy, organic, or perhaps goat's milk if they can't tolerate the cow's milk. Goat's milk is for kids, by the way. But you can do healthy fats with avocado, guacamole. If you're not vegetarian, you've got meats. They can be, if they're not ready to take them whole, you can grind them up. And hummus, extra virgin olive oil, coconut oil. Add extra healthy oils and fats where you can, and make sure you're actually getting enough healthy fat and protein.
Max Smiley donated $5 to the channel via Super Chat and has a question.
Thank you, Max.
Thank you, Max, very much. What are the steps to recovery for a torn MCL?
So the guy behind the camera, you had one of those, didn't you?
I did.
He did. He was a sprinter, this guy, actually. He was the fastest kid in Portland, barring one guy.
Second fastest freshman.
Second fastest freshman in Portland until he blew out his ACL. MCL. In his case, he needed surgery. Sometimes that's required. Occasionally, these things will heal in time, but it takes a lot of time, and it depends on the extent of the injury. We're talking months, if not years, in some cases, if you're going to let it heal on its own. Otherwise, you've just got to get it evaluated and see how bad a tear it was.
Jeff Long. Hold on one second. Did you run some PT or anything like that?
Oh, physical therapy?
I did PT.
Physical therapy is a really good idea. Sorry, my physical therapists who are watching, it's like, oh my God, this doctor doesn't even mention physical therapy. I love physical therapy, physical therapists, and I've had injuries where they were the ones that figured out exactly what was torn because they do such a careful exam and will provide you with the strengthening exercises you need and also what not to do. So very important to get good physical therapy support.
Maddie Bailey asks, good question. Do you recommend birth control to teenage girls with strong cramps? So like off-label?
So this is a tough one. So here's the thing. MDs are using birth control pills to help young ladies who are having those terrible cramps. And in fact, one of my daughters went through that, and it was incapacitating virtually for a few days each month. And it did help. My fear about birth control pills is that they also put you at higher risk for blood clots Actually, one of my kids' tutors almost lost a foot and had blood clots to her lungs and was in the hospital, almost in the ICU. So birth control pills are not without their risks, that's for sure. I would say if you have access to a naturopath who works on hormones, there are safer ways and natural hormones that can be used that will help you with those cramp issues. You definitely can do this in a much more safer. Bleh. I don't speak too good at English.
You speak just fine.
All right. Anyway, look at natural alternatives with a naturopath, or there are MDs who are integrative or functional medicine doctors who understand the hormones, can test you and figure out exactly what you need and treat you with natural hormones. I would much prefer that over birth control pills.
So, help us out, guys. Cheyenne42 says he donated money. Please answer his question. Let us know who donated that we forgot to answer a question to, and we'll correct that. In the comments below, who did we forget to answer a question who donated? Because we, of course, appreciate that.
Somehow, this is our second time doing this, and we had thought that the donations would rise to the top, but apparently they still scroll through. And
I haven't missed any. Sometimes people aren't just adding their question. I think it's getting...
It's coming later. I don't know what you guys are doing, so I'm just on the other end. 10-minute warning, I'm told. 10-minute warning. Appreciate all of you being on this live call.
Live stream.
Live stream. We're live anyway.
Cheyenne42 says Matthew Brooks hit his head on the door. He has a dent in his head now.
Ah.
We already talked about
okay, so that was the dent in the head maybe, where he hit his head, but we didn't know how it had happened. So yeah, if you hit your head and then you have a dent there, if it's not a problem. So sometimes if you actually crack the skull, bones heal by laying in new bone, and you actually will generally get a bulge. But the dent is more likely more of the soft tissue, and it shouldn't be a problem.
Hinky's Ultimate Plan. What is the best source of vitamin C?
Vitamin C naturally is in citrus. Cantaloupe is very high in vitamin C. It's going to be generally, I'd go with those as your natural. Papaya is pretty high. A lot of fruits and vegetables, especially the fruits, are high in vitamin C. But if you want to go natural, I'd go citrus and cantaloupe probably.
Evan Parsons asks, do you ever get grossed out dealing with patients?
You know, I don't. I have been grossed out though when sometimes if you have diarrhea from certain bacteria, the poop that comes out can be so incredibly foul. And of course, what we do is when patients bring in a sample of poop, I'm used to looking at poop, testing it for blood, no big deal. But when it's so pungent that it's just knocking you over, I mean, you know, you get that I'm gonna barf feeling. Yeah, that's grossed me out. I have not been grossed out by wounds, by pus, by injuries, etc.
Annette Rowe, probably messed up that name.
Sorry, Annette.
Yeah, sorry, Annette. Annette, A-N-E-K-E.
Yes.
Anyway, how do you know if you have hypothyroidism?
Hypothyroidism, generally...
Maybe say what it is real quick.
Generally, that's low thyroid function. Your thyroid's here. And you tend to be struggling now with weight gain, low energy, and sometimes your hair can change, either falling out or getting thick, and just feeling fatigue. You just got to test your thyroid levels. So TSH is usually the screen that people do, but I also like to get a free T3 and a free T4, and some people even get something called a reverse T3. You need some blood work, and it'll be plain as night and day.
Iron Sword asks, what happens if you have a seizure?
Well, if your seizure is brief and you're a kid, there's a 50-50 chance it won't happen again, and you'll have no negative consequences from having that seizure. But if you keep having seizures, or if they're very prolonged, you can go without oxygen sometimes in some cases, which is not good for your brain, obviously. And we worry a lot about people of driving age and having a seizure while you're driving. Obviously, that could be a fatal car accident or a serious car accident. So seizures are clearly a sign that we need to look for what's going on. MRI of the brain, make sure there's no mass. EEG, some seizure patterns will tell you exactly what to do for it and what's causing it.
Lizzie ASMR, do you believe ASMR is a real thing? Do you know what that is? 'Cause
I ASMR. Clarify. I'm not sure what you're talking about.
Right. Courtney, 5-minute warning, guys.
5-minute warning.
So get those questions in. Courtney Sealer asks, any advice for someone aspiring to become a pediatrician? I'm starting pre-med later this month.
Fantastic. Make sure you rotate through a couple different pediatric practices so you get a feel for what you're getting yourself into. I did that early on in my career just to sort of get an understanding of, did I want to do anything else besides be a doctor? And actually it helped me realize that's exactly what I wanted to do, was be a doctor. But find out beforehand so you kind of don't end up somewhere where it's not what you thought.
Michaela Bonino wants to know what happens in a heart attack.
So heart attack is generally where your heart is this muscle and it's working for a lot. And there are blood vessels that support your heart muscle. You need blood flow, nutrients to have function. And if one of those blood vessels, or more than one, gets occluded, you've lost your blood supply to part of that heart, and it's in the process of dying basically if it doesn't get blood flow again. And so that's what's causing it.
Susie 0007, when should I worry about swollen lymph nodes in a toddler's neck?
So these lymph nodes here are almost always related to this stuff, right? So toddlers are congested a lot, having multiple colds, especially if they're in daycare. I don't worry about these if they're associated with recurrent illnesses that are common in childhood. When you have lymph nodes, what we call supraclavicular right here, that's more worrisome. Or if you have lymph nodes everywhere, in the groin, in large spleen or liver, then it's a big deal and you need to have that looked at. But by all means, check with your provider, check with your doctor, have them look your child over and make sure it's not one of those other patterns that's more concerning. So I think we're down to our last minute or two.
We got 3 minutes left. Unless we get a massive super chat, we might
you might just have me chatting for a while.
Yeah.
He has that way of having me chat so he can pay for his hard work.
Mr. Murphy's Vlogs, how do you get to sleep faster?
Aha. I do it by being exhausted. So I run, and I'm so tired by the time I hit the bed, it's like, it usually doesn't take too long. If my mind is just going, can't turn it off, I'll take some melatonin or something called Tranquil that has melatonin, theanine, and 5-HTP. But the other thing you need to do is avoid caffeine later in the day. So I'd cut it off by about noon or 1 or 2 in the afternoon for a typical person, and get the overstimulation off at least 2-3 hours before you want to be asleep. And screens, those blue screens are terrible for sleep.
Brittany Taylor donated $2 via Super Chat. Thank you, Brittany.
Thank you, Brittany.
Is baby-led weaning safe?
Baby-led weaning, I love that book, except for one thing.
Oh,
the book basically gives you this sense that spoons are evil. And I don't know why we have to think of spoons as evil. So the concept is you let the baby tell you when they're ready to eat that drumstick, for example. And if they can't grab that drumstick and eat it on their own, they're not ready for chicken. And I don't know if I totally agree with that part of it, but everything else in that book is wonderful. I just think you can take real food, whatever you're eating as a family, grind it up and feed it to your baby if they need food. And for moms who don't have enough breast milk, you got to feed that baby sooner than they're able to actually grab hold of it by themselves.
Lauren Vlogs asks, make this week. Well, do you like having children as patients or adults? I like it now.
What?
I think just explain why you like seeing kids.
Oh, I love kids. Here's the thing. When I was in medical school and I'm going through my rotations and I do my adult medicine rotation at a VA hospital, and what were those old veterans doing? They were smoking cigarettes, drinking alcohol, coming in, their health disastrous, and saying, "Doc, fix me." And you fix them up so they can go do that some more. And they lie. Adults, do you tell the honest truth to your doctor about how much you're drinking, all the food that you're eating that you shouldn't be eating? Generally not. So I like kids. They're just so honest. And anyway, they're just so interactive and fun. I love interacting with kids. So yeah, I like kids as patients. Although I'm talking to the parents too. I enjoy interacting with people.
All right. We'll take one last question.
Final question.
Final question of the day. Let me double check for any super.
Thanks everybody for tuning in today, by the way.
Yes,
really appreciate it.
Thank you so much. We'll end it with this one. Okay. Iron Sword asks, what happens if your blood sugar gets low?
So if you get low blood sugar, you feel tired, or you can actually get very jittery, and eventually you could faint and pass out. People who are diabetic can die. That's why you have glucagon to give right away, or you have some emergency quick sugar source. So yeah, low blood sugar can happen for a lot of people if you're pre-diabetic, and a lot of us are. If you just eat too many carbs and your insulin spikes real high, its job is to get the blood sugar down, and then you go too low. So yeah, you could have those symptoms, and most of us just need to eat more protein with each meal and less processed carbs, less sugar, and we'll be fine.
Right,
so folks, I think that's it for today. I want to thank you all for tuning in, those of you who tuned in. I'm Dr. Paul, and Big Nono's running the camera from behind, of course. Thanks, Big Nono, and thank you all for watching. We'll see you next week. We're going to try to do this every Sunday. Can't promise it'll always happen, but we're going to make an effort. A big thank you to all our Super Chat donors. We really appreciate the support it gives the channel. Thanks for watching. I'm Dr. Paul.